Katarina Mollo is a clinical dietitian at the Center for Celiac Research and Treatment at Mass General Hospital for Children, specializing in celiac disease. She uses her educational background and expertise to help patients with celiac disease and other gluten-related disorders navigate the gluten-free diet, and is devoted to educational programs for increasing awareness of celiac. Katarina.
Right. Thank you so much for that wonderful introduction. Good morning, everyone. I'm so happy to be here today to talk to you about food and drug labeling. And I know there's always so many questions around reading food labels. And being able to read the food label is one of the most important skills of staying healthy and gluten-free when you have celiac disease. And it can be quite complicated. So that's a huge barrier to gluten-free diet adherence. So I really hope I can shed some light today about food labeling. How do I move the slides? Do you know?
The clicker.
Oh, there's a clicker. Oh, this one?
Yeah.
Okay. All right. All right. I have no financial disclosures. And here's just a presentation outline. I'm going to be talking about how to read the label, gluten-free labeling, FDA food allergen labeling, allergen advisory statements, medications and labeling, how to contact manufacturers, and the future of food labeling. So I have quite a lot of information to cover. So I may, in terms of time, have to skip a couple of slides. All right, I just want to start with the questions because labeling and ingredients can be complicated. So which ingredient is not safe on the gluten-free diet if it's derived from wheat? So is it A, dextrose, B, dextrin, or C, maltodextrin? Anyone know the answer? C? No, actually, it's B, dextrin. So both dextrose and maltodextrin, if it's derived from wheat, they are considered safe on the gluten-free diet, but dextrin is not. All right, so always read the food label when you have celiac disease or a gluten-related disorder, and check anything that you're going to be eating or drinking. And that includes, things like foods, beverages, gums, mints, candies, supplements, and medications. And how do you read the label? So I usually divide it into 3 steps to make it a little bit easier. So first, look, does it say gluten-free anywhere on the product? Sometimes that can be a little bit tricky to find. And then look for any allergen statements. So wheat has to be declared if present in anything regulated by the FDA, which is most food products. And then I tell people to look for 6 things on the label on something that's not labeled gluten-free. So if it's not labeled gluten-free, look for 6 things. And those are, so I mentioned wheat, and that will be listed as an allergen. Rye, barley, malt, because malt is from barley, brewer's yeast, and oats. Oats is very contaminated. So if you have something with oats, it has to be labeled gluten-free. I also always tell people any grain product or flour that also has to be labeled gluten-free because it also has a lot of cross-contact with gluten-containing grains. All right, so what is considered gluten-free? So the FDA considers a food to be gluten-free when it contains less than 20 parts per million of gluten or ppm. So this is the concentration, not an amount. And it's a pretty small concentration. So it's 0.002%. And so if you would have a gluten-free slice of bread at 20 parts per million, it would contain about 0.5 milligram of gluten. Oh, it did go. Okay. Did I skip? Okay. All right. So which foods can be labeled gluten-free under the gluten-free labeling rule? So foods that are inherently gluten-free and foods that do not contain gluten grains And foods that do contain gluten grains, such as wheat starch, but it has been processed to contain less than 20 parts per million of gluten. And it also includes any cross-contact from processing and also from packaging materials. All right, so gluten-free labeling is voluntary. Manufacturers, they do not have to disclose if a product contains gluten, and they do not have to say if it's gluten-free. And as I said, it does have to contain less than 20 parts per million, including cross-contact. And the FDA also doesn't mandate a specific gluten-free label. So a gluten-free label can look different from product to product. And sometimes that can be a little bit tricky. Sometimes you kind of have to really search for it on the products. And there are also other claims are equivalent to the term gluten-free. So if it says no gluten, free of gluten, or without gluten, that all means the same as gluten-free under the gluten-free labeling rules. So they still have to follow those rules. However, if it says made with no gluten-containing ingredients or not made with gluten-containing ingredients, that does not mean the same as gluten-free. So they do not have to follow the gluten-free labeling rule. Now, what about gluten-free certification? Because I know a lot of people are confused between gluten-free labeling and gluten-free certification. So gluten-free certification, that is done by a third-party organization that the manufacturer hires. And again, that's something voluntary. And there are several different certifications out there, and they all vary in their requirements. But they do have to adhere at the minimum to the FDA standard of being below 20 parts per million. Now, what about allergens on the label? So I mentioned wheat before. It has to be listed as an allergen on the label under something called the Food Allergen Labeling and Consumer Protection Act, or FALCPA for short. And so under FALCPA, manufacturers are required to list the top allergens, and those include wheat, milk, eggs, soy, fish, shellfish, peanuts, tree nuts, and lately sesame was also added to this. But a very important note here is that barley and rye does not have to be disclosed as allergens on the label. And as you know, wheat-free doesn't necessarily mean gluten-free. So you really carefully have to always look through the ingredient label and look for barley, malt, and rye as well. Rye would be listed on the label. It wouldn't really be hidden in an ingredient. But barley and malt can actually be hidden in some ingredients, which I'm going to touch upon in a moment. All right, so under FALCPA, wheat will have to be declared in one of two ways on the label. So either within the ingredient listing, right after the ingredient, in a parenthesis, it will say wheat, or in a contain statement directly after the ingredient listing. Usually in big bold letters, it will say contains wheat. So FALCPA applies to foods, beverages, and dietary supplements. It does not require any information about cross-contact. It does not apply to foods regulated by the USDA, the TTB. It does not apply to prescription and non-prescription drugs, pet foods, or cosmetics. All right, so I mentioned barley malt. So always look out for that on the label. So malt is almost always from barley and should be avoided. And look for things like malt extracts, malt vinegar, malt syrup, malt flavoring, brewer's yeast. Those are not safe on the gluten-free diet. Sometimes yeast extracts, brown rice syrup, and smoke flavoring and natural flavorings can also be derived from barley. And unfortunately, that wouldn't have to be disclosed under FALCPA. So if you have a product that is not labeled gluten-free and it has one of those ingredients, make sure you check with the manufacturer about the origins. All right, so USDA labeling. So which foods fall under USDA? So that would be meats, beef, lamb, pork, and poultry, eggs and egg products, and processed foods that have more than 3% of raw meat or 2% cooked meat. So things like hot dogs and chicken nuggets, deli meats would fall under this. So USDA do require that all ingredients are listed under their common name. So they can list things like starch or dextrin, but they don't have to follow FOLCPA. So if they have, for instance, starch, they don't have to say it's from wheat. However, I would really want to note here that USDA have stated that most of their manufacturers, up to 90% of them, do follow FOLCPA, because they do also produce for products for FDA, and they do encourage allergen statements. And when it comes to something under a USDA that's labeled gluten-free, they do also have to follow the gluten-free labeling rule. All right, so what about advisory statements? So this is something that comes up in clinic all the time. It causes so much confusion among my patients. So when it says things like processed in a facility with wheat, or may contain wheat, or made on the same equipment as wheat. So these statements are voluntary. They are not regulated. And these are not FOLCPA statement, because if it's under FOLCPA, I would say contains wheat. And they refer to, the processing procedures, not ingredients. But, manufacturers, they still have to follow good manufacturing practices. They still have to clean in between and things like that. So if a food is labeled gluten-free, and it has a statement like this, it still has to follow that below 20 parts per million of gluten, including ingredients and cross-contact. So if you see, so this can be very conflicting, right? You see gluten-free, and then you see something like may contain wheat, but they do have to follow that less than 20 parts per million. So that would be a safe product to eat. What about if it doesn't? It's a product that is not labeled gluten-free and it has a statement like this. Well, if you're concerned, you can always contact the manufacturer and ask them about their procedures. Most of them, they would clean in between and things like that. And you can ask them about their protocols. But I always tell people, look for the 6 things on the ingredients, like I mentioned in the beginning. And grain products should always be, and oats should always be labeled gluten-free. If not, they're usually safe. And another big thing here is that these statements don't necessarily correlate with gluten content. So they've done studies on this where they've tested products that have these statements versus not. And they actually found that the ones that did say that they may contain gluten on the product, 9% of them did have quantifiable levels of gluten, but the ones that did not have these warnings, 14% of them had quantifiable levels of gluten. So really the bottom line here is that these statements are really not that meaningful in determining if there's gluten contamination in a product. All right, so kind of to make it a little bit more confusing here. So there are some wheat-derived ingredients that are safe on the gluten-free diet. So things like distilled vinegar, distilled alcohols, citric acid, glucose syrup, maltodextrin, and dextrose. And there's also a really good, if you want to learn more about confusing ingredients, NCA has a really good webpage on this, because it would probably take me all day, all this conference day, to talk about each ingredient. All right, what about wheat starch? So this is another big thing in clinic that patients ask me a lot about, and I got a lot of emails also about this. Oh, I found this gluten-free product, but it says it has wheat starch in it. And this can seem a little, disconcerting, but wheat starch is actually allowed in gluten-free products as long as it's been processed to contain less than 20 parts per million of gluten. And also, if a product has wheat starch and is labeled gluten-free, it does have to have an extra statement on there that the wheat has been processed to allow this food to meet the FDA's requirements for gluten-free foods. And note that regular wheat starch is not safe on a gluten-free diet, right? Only if it's labeled gluten-free and it has that statement on there. What about oats? So this is another huge topic within the celiac community. So most commercially available oats in the United States are heavily contaminated with gluten-containing grains and are not safe when you're on a gluten-free diet. However, gluten-free oats is considered safe for most people with celiac disease. There's a small group of people with celiac disease that also cannot tolerate the protein in oats, but most people can tolerate gluten-free oats. And then I know there's all these different protocols out there, purity protocol, sorted oats, to render oats gluten-free. However, none of these protocols, have been, they're not standardized. So really the big thing here is that a product really has to test below 20 ppm to be safe. So always look for a gluten-free label on any oat product or any product containing oats. All right, contacting the manufacturer is really important when you have celiac disease and something you really have to get comfortable with. And the quickest I always find is just to call the manufacturer. Usually the number is on the product itself. And you can also go online on the FAQ section and look. I found you can email them. I find calling is easier, just talking directly to a person. And if you feel like, oh, you didn't get your question answered, you can always escalate and to ask more information. And if you're ever in doubt, don't risk it. What about medications? So gluten can be used as a filler in medication, but this is really, really rare. But you should always check medications, both, over the counter and prescription medications for ingredients. And the big thing here is FALCBA doesn't apply to medications. So if they would use a starch in a medication, they do not have to disclose if it is from wheat. And FDA has issued a draft guidance for how gluten should be labeled on medications. You might see this statement contains no ingredients made from a gluten-containing grain, wheat, barley, or rye. And how about doing medication research? Sometimes it can be a little bit trickier than with foods. So first, you can always inform your doctor and pharmacist about your gluten-free need. And always, check the insert, if there is an insert on your medication for the inactive ingredients. You can also call the manufacturer and again, ask them for the inactive ingredients because that's where the starches would be. And then ask them the origins of the starch if it does contain a starch. And I recommend not asking the company, is this gluten-free? Ask them instead about what are the ingredients in this product? Because if you ask, is this gluten-free? Most of them, I'm not going to be able to answer that because unless they're testing for gluten, and most companies are not testing medications for gluten. So ask them just for the ingredients. And there's a really great government website called Daily Med where you can look up medications and you can look up the inactive ingredients. And most of the time they will list origins of starches on there. And finally, if you are unable to get a gluten-free medication, which again would be very, very rare, you can use a compounding pharmacist. All right, so labeling is complicated and it would be really nice if things like, barley and rye would be disclosed as allergens and, gluten would be disclosed in medications. And so the Food Labeling Modernization Act of 2023 was introduced this past April, and it would require the amendment of FALCBA to include barley and rye as allergens on the label. So if you have something, for instance, yeast extract is one of those things that may be in rare cases derived from barley, then it would have to disclose that on the label, just as the same way as wheat is disclosed either in parentheses right after or in a contained statement. And our next speaker, Marilyn, she will also talk more about advocacy and policy change. Then there's also the ADINA Act, which is a bill that was just introduced that would require pharmaceutical companies to disclose food allergens and gluten in medications. And here I just included some resources, Gluten-Free Watchdog and NCA. You can go on the NCA site to have a really good page on confusing ingredients, like I mentioned, and Daily Med to look up medications. And then you can always check us out at Center for Celiac Research and Treatment at celiaccenter.org for more information on celiac disease and the gluten-free diet. All right, thank you.
Can you guys see my screen now as well? Yep, we're good.
Perfect. All right. Well, good morning, everyone. Thank you so much for the opportunity to discuss one of the barriers to implementing the gluten-free diet, food insecurity. I will start off first by talking about what food insecurity means, why individuals on a gluten-free diet may be at increased risk, and then I will briefly review a study that our Boston Children's team conducted, as well as several other studies talking about how food insecurity can impact individuals with celiac disease. So before I start, I'd just like to define a few terms. Food insecurity is defined by the USDA, the Department of Agriculture, as a lack of consistent access to enough nutritionally adequate, safe, and acceptable food for an active and healthy lifestyle. In 2022, 1 out of 6 children in the US live in a food insecure household. And this food insecurity cannot be just due to financial issues, but also the actual access to food. We know that childhood food insecurity has been associated with poor health status, developmental risk, mental health issues, and poor educational outcomes. And it presents in the family as food anxiety, diet monotony, decreased nutrition quality, or inadequate food intake. And I think a lot of us remember, especially during the COVID pandemic, where food insecurity increased drastically for the general public, and we saw a lot of the empty shelves, and a lot of decreased access as there was issues with our production lines. For individuals with celiac disease, food insecurity is an important and very relevant topic. We know that a gluten-free diet is substantially more expensive than a gluten-containing counterparts. The figure on the left is from a paper from Lee 2019, where they did some market basket studies showing how gluten-free products can cost about 2 to 3 times more. And so the orange is like regular gluten-containing products, and then gluten-free products are those that are blue. And so you can really see the variation around some of the products there. The other thing that is important, and that was kind of further exacerbated recently, is that a lot of state and federal food assistance programs do not account for the increased cost of gluten-free foods. And as I mentioned before, during the COVID pandemic, there was the added complexity of severe disruptions to our food chain, limiting availability of ingredients and many of the grain substitutions that are commonly used. So not only is gluten-free food more expensive, but oftentimes it can be harder to find, though it has gotten a lot better over the last few years. I know many of you are aware of the cost of the gluten-free diet personally, but I thought this was a particularly powerful example of looking at gluten and gluten-free counterparts and comparing a grocery bill. These prices were taken out of Stop and Shop in Natick, Massachusetts in January of 2018. We excluded special offers, and prices were given per pound because usually they're smaller package sizes of gluten-free products. And what you can see is that the gluten-containing bill is about $21 for 10 products, but a gluten-free bill is about $52 for 10 products. So it's about, at that time, which has now been 5 years, 248% more expensive. So I've kind of now highlighted what food insecurity is, why it can be potentially an issue for patients with celiac disease. I'm now going to tell you about 2 studies that I performed in adults who have celiac disease, which have shown that those who have dietary restrictions, such as celiac disease, are more likely to be food insecure. In the first paper, they looked again during COVID-19, and they found, this is from the National Women's Health COVID-19 study, which in the time period of April 2020, they surveyed adult women using like an Opinions for Good Health Care panel, and they specifically oversampled those who were in the East and Southeast Asian woman ethnicity to try and kind of have some variation. And they found that households with dietary restrictions were more likely to be food insecure than households without restrictions. For the second paper, this was actually based on the US National Health and Nutrition Examination Survey from 2009 to 2014. This is a survey that is done every few years, looking at adults and children. And it's a broader survey. It's not just meant looking at food insecurity, but what they found was that 1 out of 6 adults who said that they had celiac disease were food insecure and actually less likely to fully adopt the gluten-free diet. And they had a much reduced daily nutritional intake of both micronutrients and micronutrients. So there's potentially compounding effects as like an untreated celiac disease and also not being able to absorb all the necessary nutrients that they have. These are both papers that focus mostly on adults. So I'm just going to briefly talk about a study that we did at Boston Children's, which was one of the first to determine the prevalence of food insecurity in families with a child on a gluten-free diet, and how we found that food insecurity affected gluten-free diet adherence during the pandemic. We conducted an electronic survey via social media in 2021, where through Facebook groups and other kind of celiac social media groups, we asked individuals to fill out a survey that comprised of asking their food insecurity risk versus the hunger vital sign, which I'll talk a little bit more about on the next slide. We also did a slightly longer food security survey module. We asked about gluten-free food accessibility. We also assessed their social economic status using their zip code and kind of pairing that with another marker of kind of neighborhood and zip code status of social economics. I really wanted to highlight these two questions, which we use to measure food insecurity, which is known as the hunger vital sign. It's a validated screener, and that having these two questions, if you answer yes to either one, places you at a more risk of food insecurity. And we found that those who were positive with these two questions were similarly positive with our 6-item short form food security survey model. So it kind of validated to us that this was adequate to use. And I think what we also innovated on is we added specifically also the aspect of asking about gluten-free food specifically, and not just asking about food in general. And so just to talk about our results, we had over 378 households with children who responded to the survey. Predominantly, our participants were from a privileged socioeconomic status with income of greater than 80,000, well-educated, and were from a comfortable zip code. 68% of children attended public schools, 82% had been diagnosed via biopsy. And the public school point I will come back to a little bit later in my talk, but I did want to highlight that. And so just to kind of summarize our results, we found that food insecurity and gluten-free food insecurity increased during the pandemic. Usually was between 20 to 27% for overall food insecurity and then gluten-free food insecurity. But I think what was important for us was that one out of the 20 households who were food secure, and that they were not food insecure on the two questions, but they screened positive for gluten-free food insecurity, so that there is perhaps a difference between the two and to ask about both. The second is we found that there was a near doubling of intentional gluten ingestion due to limited gluten-free food availability. We found that you had an increased odds of intentionally ingesting gluten if you screened positive for food insecurity or gluten-free food insecurity. The odds, of course, increased if you were positive for gluten-free food insecurity. And the other thing that we found associated was that if there was multiple household members following a gluten-free diet, there was also an increased odds of intentional gluten ingestion, probably explained because it might be a higher budget cost for the family. We also asked specifically about gluten-free food availability, and we showed that there was a decrease throughout the pandemic. We are focusing on the yellow color. The green and the blue are telling us readily available. And then the yellow, as you can show, expanded since the COVID pandemic, shows like about a 22% increase of people saying there's limited availability. And what that means is having to go to more stores and having to use online shopping as well to access more gluten-free products. So to summarize, we conclude that food insecurity can pose a health risk to patients with celiac disease and potentially can result in intentional gluten ingestion. We've talked about how gastroenterologists should consider food insecurity screening, especially in the setting of patients with celiac symptom exacerbation. And I think I also really need to acknowledge how we designed our survey. In some way, it is a convenient and it's a non-random sampling. So it was sent to individuals who have access to internet, who are able to fill it out via the how we distributed it on social media. And we did have a bias towards more affluent families. And so we're actually very likely underestimating the rates of food insecurity in our population of celiac patients. And now I don't want to end the slide on saying that we have identified that this could potentially be a concern. I also want to just highlight on the things that we're doing to, now that we've identified that this could be an issue, and things that we're acting on as well, and how we are screening more of our celiac patients in clinic and referring them to different resources. So you asked the question, how else can we help? We're building resources in the community with Boston Children's, having our food pantry. I'll talk a little bit more in the next slide. We're talking more about natural gluten-free WIC products. I think you remember that I mentioned that oftentimes state and federal funding does not compensate for the higher prices of gluten-free products. So how is it that we can highlight, which is very relevant to the labeling talk that you guys just heard, but what are other products that are gluten-free, natural, that people can use through WIC? And then our third point is ensuring all have access to safe gluten-free school lunch and breakfast. I'll elaborate a little bit on each, being respectful of time. Boston Children's has connected to launch a new community program, Family Food Connections, a food pantry in Jamaica Plain. And so we are able to send some of our patients there to get totally gluten-free packages through that, just listing some of the natural gluten-free options through WIC. And then finally, I just wanted to talk about some of our future interventions and hopes is that, as you guys know, the COVID pandemic did bring some positives in that many of the school free lunches, many of the schools were able to offer free lunch and breakfast regardless of need. And Massachusetts is actually one of the few who has now continued it officially. And what we found over the last year, though, is that when we surveyed some of our elementary school patients with celiac disease, 45.3% have never consumed the free school lunch. And this was during the last 2 years where everything was free with regardless of need. 85.3% had never consumed free school breakfast, and 50% of those who screened positive for food insecurity had never consumed school lunch or breakfast. And so we're realizing these are areas where we could potentially help to make it show that people feel safe about eating school lunch and school breakfast, as well as making sure that we are able to utilize all the resources that are available for our patients. I wanted to acknowledge some of the co-authors in the prior paper, and you guys for listening, and I'm happy to answer any questions after the other speakers. Thank you.
Thanks, Nan. Great to hear you. Our last speaker in this session is Marilyn Geller. We're very happy that she's here. Marilyn is the CEO of the Celiac Disease Foundation, which is the nation's leading patient advocacy organization for celiac disease. Under her guidance, CDF has seen unprecedented growth through the development of multiple online tools that have empowered millions of patients worldwide to seek diagnosis and treatment. And this organization really is a global organization. Marilyn.
Thank you very much for that kind introduction. So I am Marilyn Geller, and I'm the CEO of the Celiac Disease Foundation. And I am absolutely delighted to be with you here today in person. Shout out to those of you on the West Coast who joined early. I want to express my appreciation for the diligence and unwavering leadership of our education partner, the Boston Children's Celiac Disease Program. Boston Children's, as you know, plays a pivotal role in ensuring that our healthcare providers and patients are well informed about the latest developments that significantly impact the lives of those affected by celiac disease. And again, I want to thank all of you here today and those of you joining virtually for your active participation and dedication to our very important cause. So I also want to acknowledge and appreciate the insightful remarks made by my fellow speakers. Everything discussed here today has brought us to a critical juncture, the discussion of patient advocacy. As a global patient advocacy organization, the Celiac Disease Foundation works tirelessly each day to elevate the celiac patient voice in the halls of the U.S. Congress and around the world. Our mission is clear: to ensure that the decision makers understand that celiac disease is not a passing dietary trend, but one of the world's most prevalent genetic autoimmune diseases. It significantly impacts both physical and mental health, and it's our responsibility to make sure that it's recognized as such. All right. Point it that way. Oh, no. Went ahead of myself. One to the right. Okay, there we go. So you are our valued healthcare providers, and our resilient patient community play a pivotal role in these advocacy efforts. Today, I'm here to provide an overview of how the Celiac Disease Foundation advocates and to share how each one of you can contribute to this vital cause. All right, so first and foremost, let's address the question, why should you advocate? Well, the federal government holds the key to significant medical research funding in the United States. And until 2020, celiac disease research was woefully underfunded, which has hindered our progress in understanding and treating our disease. Every day, Congress and federal agencies, and apparently starting tomorrow, will continue to do so, make decisions that impact medical research funding and healthcare access. So the most effective way to ensure that your needs are considered in these policy decisions is by sharing your personal stories and explaining how the specific policies affect you or your loved ones. Since my testimony to Congress in April 2019, and with ongoing yearly Hill Days and dedicated outreach by the Celiac Disease Foundation and our advocates, Congress has finally acknowledged the importance of celiac disease research. We've secured $9 million annually for celiac disease research since 2020, which is a significant step forward, but it's not enough. And this direction needs to continue year after year. And this is where your support becomes critical in contacting your congressional representatives. So what are we requesting for 2024? To ensure consistent support for celiac disease legislation, we're committed to building the Celiac Disease Congressional Caucus. Chaired by Representative Betty McCollum, who herself has celiac disease, the caucus is a powerful advocate for our cause. We continue to advocate for federal funding at both the National Institutes of Health and the Department of Defense for celiac disease research, better diagnostics, improved management, and the quest for new treatments, and ultimately, a cure. Additionally, we work to enhance gluten-free food labeling requirements, strengthen patient protections, combat food insecurity within the celiac population, extend Medicare and Medicaid coverage for medical nutrition therapy, which covers dietitian visits, and address issues at federal agencies, including increasing FDA funding for enforcing the gluten-free labeling rule to ensure the safety of our food supply. All of these efforts aim to enhance the quality of life for those with this serious chronic, and as we know, life-altering disease. All right, so advocacy partnerships are instrumental in enacting legislation. And one of the most influential ways we advocate for our patient community is by collaborating with our community and our partners to encourage the federal government to enact policies that improve the lives of everyone affected by celiac disease. So earlier this year, we led a group of 21 medical professional and nonprofit organizations in sending a crucial letter to the U.S. Department of Agriculture, addressing the needs of celiac patients facing food insecurity, as you've heard. We're grateful to our fellow Celiac Smart sponsors for their pivotal role in this effort. In the letter, we outlined the needs of patients participating in the Special Supplemental Nutrition Program for Women's, Infants, and Children, known as WIC, and we provided recommendations for program improvement. So believe it or not, in that program, definitions actually could exclude our gluten-free products, and we eagerly await the results of our work. Okay, so by this time, after hearing everything you've heard today, I am hopeful that you are asking yourself, how can I be involved? Anyone? All right, so the good news is that there's numerous ways to engage and support our shared mission of enhancing the quality of life for our celiac community. So first, you can register to become a Celiac Disease Foundation policy advocate at iadvocate.celiac.org. Training is entirely free, and it's going to equip you with the knowledge and tools you need to get involved. So policy advocates are special. They get to meet in person with their congressional representatives or virtually, and they get to rally their networks to support our legislative requests. If becoming a policy advocate feels like too big a step right now, you can easily, for the comfort of your own home, contact your legislators with a few clicks by visiting celiac.org/take action. and you can ask them to support celiac disease policy efforts. Another impactful way to contribute is by sharing your celiac disease story. So your experiences and your insights as a parent, as a caregiver, as a patient, as an advocate for somebody that you care about can help drive awareness and drive change. You can share your story at celiac.org/share your story. As an example of how this works, in 2019, we collected over 800 stories, and these are the stories that we shared with Congress, and that was instrumental in our efforts to secure the first NIH funding for celiac disease research. So it does work. And moreover, we urge you to share our Participate in Research page with your networks. And by networks, family, friends, somebody you meet in the grocery store, anybody and everybody you come in contact who might tell you that they know somebody who has celiac disease. This page lists what clinical trials are available that the Celiac Disease Foundation is a partner in recruitment for. And the reason why it's important is the most significant hurdle in getting a drug to market is getting people into the trials to participate. So you can learn more and you can see if you qualify for a clinical trial at iqualify.celiac.org. All right, so on a similar note, you can join the more than 14,000 participants in the iCure Celiac Patient Registry. And so by sharing your or your child's experience living with celiac disease with research and policymakers who we share anonymized data, your data is held to the strictest privacy standards, but we share this group data, and it contributes to the development of better treatments and one day a cure for celiac disease. So the data actually demonstrates to biopharma and Congress that a gluten-free diet is not a cure for celiac disease, and that for many of us, we require additional treatment and protections to lead a healthy life. So please learn more and please join at icure.celiac.org. All right, so beyond today, if you have any questions or need assistance, please don't hesitate to reach out to our team at advocacy@celiac.org. We stand ready and enthusiastic to answer your questions and help you join in our advocacy efforts. And once again, I'd like to extend my heartfelt gratitude to Boston Children's Celiac Disease Program for your leadership and this important symposium. The support and dedication to our celiac community is just invaluable. And again, thank you to all of you for your commitment for being here today for our cause and for making a difference in the lives of those affected by celiac disease. I mean, together we really are creating a brighter future for our community. So thank you.
Thanks, Marilyn. I'm going to let you sit down before I hit you with a question. Now, one of the individuals, we have a number of professionals who are attending the conference. So we got a question from one of the dietitians. So is there a specific way that professionals, namely dietitians, can get involved?
Well, as a dietitian, I'm going to tell you that the very first thing you can do, if you have not already, is to join the program to get your certificate in gluten-related disorders. And this is offered as a joint partnership between the Academy of Dietetics and Nutrition, the Celiac Disease Foundation, and SHAR. So the Celiac Disease Foundation and SHAR helped fund the program to develop this training program. The Celiac Disease Foundation provides scholarship through the generosity of SHAR for dietitians so that you can take that program and be reimbursed for your tuition. So that's the first thing, get as educated as you can. But anybody can be a policy advocate. And actually, I shouldn't say anybody, that sounds not as important. Everybody can be a policy advocate. Whether or not you have celiac disease, if you are passionate about this cause, you can take the iadvocate.celiac.org program to become a professional advocate. And you can always, like I said, if that's too big a step, at least go to the Take Action page, look at the initiatives. There are pre-formatted letters. You literally just click a button. It asks you for your name and your address, and it sends them off to your congressional people. And you can even modify them to say, I am a dietitian, and this is why it's especially important to me.
Great. That's a wonderful answer. Katarina, there's a number of questions for you. I think we'll take one of them. So rice is a staple for patients with celiac disease. Do you have to look for gluten-free rice labeled with a gluten-free label?
Right, no. So rice is actually one of the exceptions. So rice has a very low risk of cross contact with gluten containing grains. So rice, you do not have to look for a gluten-free label on rice and rice products.
Great, thank you. Please remember, people here who are live, come up to the microphones. No wait here for a question. Go ahead.
It's
Please
just-
identify yourself.
Susan Stewart. I'm the mom of 2 celiac kids. And I wondered about dextrose, because you started your talk with the quiz and I got it wrong, but I wasn't sure how dextrose could be avoided by looking at the 6 things that you said you tell patients to look at.
Oh, so dextrose is okay on the gluten-free diet. Okay, so it was dextrin and maltodextrin, those are okay, but dextrin is not okay. I know I included it because it is very complicated and they all look so similar.
So how would you find dextrin on a label?
Right, so if it's on anything that is labeled under FDA, they do have to disclose if it's from wheat. So it would be in that parentheses right after or in the statement right after. So then you know to avoid that. If it's a USDA product, or a medication, they do not have to list if it's from wheat. So then you kind of have to investigate that and contact the manufacturer. There are also some products out there that have been processed and the processed dextrin to contain less than 20 parts per million, but then it would be listed on there as well. All right, I hope that clarifies that.
Great.
Wait, I want to ask a question.
Okay.
Okay.
Last questions from Marilyn.
Well, no, it's the dextrin question. So
Okay.
also as the mom of someone with celiac disease and somebody who has to eat gluten-free myself, what example of a product has dextrin in it? Because I have to say I've never looked for dextrin.
I mean, it can be used as a filler ingredient in products. And I mean, you don't see it that often, but if it says, I think a lot of people also confuse it with maltodextrin. But if you, and dextrose. That's why I included that questions, because those 3 are very, very confusing. But a lot of the times dextrin is actually from corn. So on something regulated under FDA, if it just says dextrin, then it's from corn, most likely from corn. If it's from wheat, it would be listed in that parentheses, as I said. Does that make sense?
I think I'm more confused, but thank you. We'll talk later.
Okay. So the next event is break. So we're going to still give you all a 10-minute break so you can get some coffee or visit the restroom. So we'll see you all back here at 11:15.